Vitamin B12 is often called the energy vitamin, and for good reason. It acts like a spark plug in the body's energy production process, helping to transform the food consumed into fuel at the cellular level. This crucial vitamin supports the function of red blood cells, which carry oxygen throughout the body, as well as the health of nerves and brain cells. When levels of B12 drop, it can lead to symptoms that include fatigue, weakness, and mental fog, which can easily be mistaken for normal aging. Doctors emphasize that men over 60 are particularly vulnerable to B12 deficiency, largely due to changes in how the body absorbs nutrients. As the stomach produces less acid with age, the body's ability to extract B12 from foods like meat, eggs, and dairy can become compromised. Even if the diet is rich in these foods, the vitamin might not be absorbed effectively. Some men might also take medications that interfere with B12 absorption, including common antacids and certain diabetes drugs. Supplementation is often recommended to bridge the gap and help restore energy levels. Doctors generally advise choosing forms of B12 that are easier to absorb, such as sublingual tablets or injections, especially for those with known absorption issues. Research supports the role of B12 in preventing anemia and maintaining healthy nerve function, both of which are essential for feeling strong and alert. By ensuring an adequate intake of B12, men over 60 can often experience a noticeable improvement in energy, mental clarity, and overall vitality. This vitamin's role in cellular metabolism makes it an essential part of any plan to maintain strength and health as the years go by. Regular testing and consultation with a healthcare professional can help determine individual needs and ensure that levels remain optimal. Low levels of vitamin B12 can have a profound impact on energy and overall well-being, particularly in men over 60. When B12 is insufficient, the body's ability to produce healthy red blood cells is compromised, leading to a condition called megaloblastic anemia. This type of anemia reduces the amount of oxygen that tissues and organs receive, often resulting in fatigue, weakness, and a persistent feeling of low energy that can be mistaken for the normal aging process. These symptoms can quietly undermine daily activities and contribute to a sense of sluggishness that feels hard to overcome. In addition to its role in red blood cell production, B12 is essential for maintaining the health of nerve cells and supporting the proper function of the brain. Low levels of B12 can contribute to mood changes, including depression-like symptoms, confusion, and even memory problems. Research has shown that seniors with B12 deficiency are at a higher risk of cognitive decline, which can further affect energy and motivation. Many older adults might attribute these issues to getting older, not realizing that low B12 could be the hidden culprit. Doctors emphasize that routine testing for B12 levels is crucial, especially in men over 60 who experience unexplained fatigue or mood changes. Early detection of deficiency allows for timely intervention with dietary adjustments or supplements, often resulting in significant improvements in energy and mental clarity. Some doctors warn that untreated B12 deficiency can lead to irreversible nerve damage, making it even more important to address this issue without delay. Understanding the signs and seeking proper evaluation can be the first step toward reclaiming vitality and enjoying life with renewed energy. Many seniors overlook some of the most reliable sources of vitamin B12 that can naturally support energy and overall health. Lean meats, such as beef and poultry, are among the best dietary sources, providing a highly absorbable form of B12 that helps maintain healthy blood and nerve cells. Eggs, particularly the yolks, also supply a good amount of this essential vitamin and can be easily included in meals. Dairy products like milk, yogurt, and cheese are another excellent source of B12, and they come with the added benefit of calcium and protein, which are important for bone health. Fortified cereals have become a valuable option for those who may not consume enough animal-based foods. These cereals often contain added B12, making them a convenient choice, especially for breakfast. Some seniors choose to limit or avoid these foods because of changes in taste, chewing difficulties, or dietary restrictions recommended for other health conditions. However, many doctors highlight that including these foods in moderation can make a noticeable difference in energy levels and overall well-being, helping to prevent fatigue and mood issues often associated with low B12 and dental issues, including missing teeth or ill-fitting dentures, can also make eating meats or tougher foods more challenging, leading to unintentional avoidance of these important sources of B12. Addressing these dental concerns with a healthcare professional can help seniors regain access to these foods and the nutritional benefits they provide. Including B12-rich foods in the diet supports the body's ability to produce red blood cells and maintain healthy nerve function, both of which are key to feeling strong and energetic. Making small, manageable adjustments to meals can have a significant impact on health and vitality. As men get older, changes in digestive health can quietly interfere with the body's ability to absorb essential nutrients, particularly vitamin B12. One of the key factors in this process is stomach acid. The stomach produces hydrochloric acid, which is critical for breaking down the protein in foods that carry vitamin B12. When acid levels are adequate, B12 is released from these proteins and binds to a substance called intrinsic factor, allowing it to be absorbed further down the digestive tract. However, after the age of 60, many men experience a natural decline in stomach acid production, a condition known as hyperchlorhydria. This decline in stomach acid means that even when consuming foods rich in B12, like lean meats, dairy, and eggs, the II vitamin may remain trapped in the food matrix and pass through the digestive system unabsorbed. Doctors often explain that this is why some older adults develop B12 deficiency even with a seemingly healthy diet. Studies have found that low stomach acid is a leading cause of B12 deficiency in seniors, contributing to symptoms such as fatigue, weakness, and even cognitive changes that might otherwise be blamed on aging. The connection between low stomach acid and B12 deficiency is not always obvious, as digestive discomfort or heartburn symptoms might actually mask the underlying problem. Some men turn to antacids or acid-reducing medications which can further decrease stomach acid levels, compounding the issue. Doctors sometimes recommend checking B12 status in older adults who regularly use these medications or report digestive problems, as even mild deficiencies can impact energy levels and mental sharpness. Addressing this hidden link involves paying attention to digestive health and recognizing that low stomach acid might be a barrier to getting enough B12. For some, dietary adjustments, such as including more easily absorbed forms of B12 or discussing supplementation with a healthcare professional, can help bridge the gap. Regular testing of B12 levels, especially for those experiencing fatigue or unexplained weakness, can help identify deficiency early and allow for proper management. Recognizing the role of stomach acid in B12 absorption is a crucial step in ensuring that men over 60 can maintain their energy and overall vitality. Supplements can play a crucial role in maintaining healthy vitamin B12 levels, especially for men over 60. As the body ages, natural absorption of B12 from food can decrease due to reduced stomach acid production, leading to fatigue, weakness, and even mood disturbances. In these cases, supplements can be an effective way to ensure the body gets the B12 it needs to produce healthy red blood cells, support nerve health, and keep energy levels up. However, taking B12 supplements incorrectly can limit their benefits, or even cause problems, making it essential to understand the safest and most effective ways to use them. Doctors often recommend different forms of B12 supplementation depending on an individual's needs. Oral pills are the most common and are widely available in pharmacies and health stores. These pills are easy to take and can help maintain B12 levels, especially in people with mild deficiencies. However, because B12 absorption in the gut can be compromised in older adults, especially in those with low stomach acid or certain digestive conditions, oral supplements may not always be fully absorbed. This means some men might continue to feel fatigued or mentally foggy despite taking daily pills. For those who have trouble absorbing B12 through the stomach, sublingual supplements offer a practical alternative. These come in the form of lozenges, or drops that dissolve under the tongue, allowing the vitamin to be absorbed directly into the bloodstream through the mucous membranes. This method bypasses the digestive system, making it a more reliable option for those with absorption issues. Doctors sometimes suggest sublingual B12 for seniors who experience fatigue or who have been diagnosed with low B12 levels. In more severe cases of deficiency, doctors may recommend B12 injections. These injections deliver the vitamin directly into the bloodstream, ensuring immediate and complete absorption. They are often used when blood tests show significantly low levels or when symptoms are particularly severe, such as in cases of megaloblastic anemia or pronounced nerve problems. Some men may need a series of injections over several weeks or months to restore normal levels, followed by maintenance doses to keep levels stable. Although injections require a healthcare provider's assistance, they can be life-changing for those whose energy levels and mental clarity have been impacted by deficiency. Doctors stress that choosing the right form of B12 supplementation depends on individual factors, including current levels, digestive health, and other medical conditions. Before starting any B12 supplement, it's wise to discuss options with a healthcare professional who can recommend the most effective and safest approach. While B12 is generally considered safe, extremely high doses may cause side effects, such as mild digestive upset in some people. Monitoring B12 levels through regular blood tests can help ensure that supplementation is working effectively and that no other underlying issues are contributing to low energy. Taking B12 supplements the right way can help men over 60 reclaim their energy and vitality, supporting an active and fulfilling life well into their later years. Not all vitamin B12 supplements are created equal, and some can actually do more harm than good. As men over 60 seek to boost their energy and vitality, it's important to know that some supplements on the market may be poorly absorbed or made with unnecessary fillers. These fillers can cause digestive upset, particularly in those with sensitive stomachs or other digestive issues. Supplements that don't clearly list their ingredients or use vague terms like proprietary blend can mask what's really inside, making it hard to tell if you're getting a quality product or just an expensive placebo. Doctors often caution that some B12 supplements are labeled with doses far exceeding what the body can actually use. While B12 is generally considered safe because excess amounts are usually excreted in urine, unregulated doses may not always be as effective as promised. Some products may advertise high potency or mega doses, but studies show that after a certain point, the body's ability to absorb B12 plateaus. This means that taking more doesn't necessarily mean you'll benefit more. It may just be a waste of money. Worse yet, some poorly formulated supplements may even interact with certain medications or medical conditions, making it important to be cautious. Quality is key, and some experts advise looking for reputable brands that clearly label their active ingredients and specify the form of B12 they use, such as methylcobalamin or cyanocobalamin. Methylcobalamin is often recommended for its better absorption, but both forms can be effective if manufactured properly. Checking for third-party testing or certification by organizations like USP, United States Pharmacopeia, can help ensure the supplement actually contains what it claims and is free from contaminants. Doctors also warn against buying supplements from unreliable online sources or from sellers who make exaggerated claims. Statements like miracle cure or guaranteed to triple your energy should raise a red flag. B12 is a vital nutrient, but it's not a magic bullet. Supplements can support healthy energy levels, but they work best when combined with proper medical guidance, especially for seniors who may have other health concerns. By learning how to spot quality supplements, men over 60 can protect their health and avoid wasting money on products that won't deliver the benefits they need. Many doctors don't routinely check vitamin B12 levels unless a patient specifically brings it up, which can leave many men over 60 feeling drained without knowing why. To make sure you get the attention you deserve, it's important to ask the right questions during your appointment. Asking your doctor directly about testing for B12 levels is a good start. Some experts recommend requesting a simple blood test called serum B12, which can show if your levels are low. However, It's worth noting that some doctors advise that serum B12 alone isn't always enough to catch early deficiency. If your energy levels have dipped, or you've been experiencing memory lapses, weakness, or numbness, sharing these symptoms with your doctor can strengthen the case for testing. In some cases, additional tests like methylmalonic acid, MMA, or homocysteine may be recommended, since they can reveal a deficiency even when serum B12 looks normal. Doctors sometimes point out that early detection is key to preventing more serious problems like nerve damage or anemia, which are harder to treat once they set in. Being clear and direct about your concerns helps guide the conversation in a productive way. Instead of just saying, "I'm tired," consider mentioning specific changes you've noticed, like reduced stamina or trouble concentrating. Bringing a list of your current medications can also be helpful, as some drugs, such as certain antacids or diabetes medications, may interfere with B12 absorption. Asking your doctor to explain the results and outline a plan, whether that means dietary changes, supplements, or further tests, ensures you walk away with a clear picture of what's happening in your body. By being proactive and prepared, you take control of your health, avoiding the confusion and guesswork that often leave seniors feeling overlooked. While vitamin B12 is key to energy production, it does not work alone. Experts point out that B12 functions best when other essential nutrients like vitamin B6, folate, and iron are also present in adequate amounts. These nutrients work together in a complex network that helps your body transform food into usable energy at the cellular level. For example, vitamin B6 assists enzymes that convert stored energy into fuel your cells can use, while folate supports the production of red blood cells which carry oxygen throughout the body. Iron, on the other hand, is a building block for hemoglobin, the protein that enables your blood to transport oxygen efficiently. Some doctors warn that focusing only on B12 without addressing these additional nutrients can leave you feeling tired and frustrated, even if your B12 levels look normal. When iron is low, for instance, the blood's capacity to carry oxygen is reduced, leading to fatigue and weakness. Similarly, insufficient folate can cause anemia and leave you feeling sluggish. These issues are especially common in men over 60, who may already be dealing with decreased nutrient absorption due to age-related changes in digestion. Recognizing this synergy is crucial for getting the full benefits of B12 supplementation or dietary changes. Instead of relying solely on B12 to lift your energy levels, consider discussing with your doctor whether other nutrients might also be part of the picture. A simple blood test can reveal deficiencies in iron or folate, allowing for a more comprehensive approach to tackling fatigue. By understanding how B12, B6, folate, and iron support each other, you can work towards reclaiming the vitality that makes everyday activities feel easier and more enjoyable. This balanced strategy ensures that all the key players in your body's energy production get the support they need. Men over 60 often face unexplained fatigue, and many assume it's just a normal part of aging. However, some doctors highlight real-life stories of patients whose lives changed dramatically after addressing B12 deficiency. One patient shared how he had struggled to get through the day, battling constant exhaustion, until his doctor recommended testing his B12 levels. The test revealed a significant deficiency, and with proper treatment, his energy returned, allowing him to enjoy activities that had once felt impossible. In another case, a man had been dealing with numbness in his hands and feet, which affected his ability to garden and pursue hobbies. A neurologist found that his B12 levels were below the recommended range. After several weeks of B12 injections, he noticed a marked improvement, not only in his energy, but also in his ability to move and participate in daily tasks. Stories like these highlight how B12 supplementation can help men reclaim the vitality they may have thought was lost. A patient in his late 60s, for instance, reported feeling a fog lifting from his mind, making him more alert and engaged in conversations. Doctors explain that this mental clarity often goes hand in hand with restored energy, as B12 plays a crucial role in nerve function and oxygen transport. These real-life experiences serve as a powerful reminder that it's never too late to address vitamin deficiencies and regain a sense of well-being. For men over 60 who find themselves dragging through the day, asking a doctor to check B12 levels could be the first step toward a renewed sense of purpose and energy.